We know well that nurses and doctors right now are on the front lines helping to fight COVID-19, but so are our medics. Joining us this morning to talk a little bit more about their role in response to public health emergencies is Selena Shie, president of Austin Travis County EMS Association. Good morning, Selena. Thanks for being with us.
Thanks for having me.
Absolutely. Selena, so how are medics doing? As you know, you are hearing from these folks that are on the front lines. How are they doing?
Our medics are doing well. In general, they have been trained to work in all sorts of environments. I do think that COVID-19 has really caused a disruption in the way that we are thinking. However, it has completely changed the way that we operate at work. I think one medic put it really astutely that being a medic, you kind of develop this intuition, this gut sense of exactly how to treat each patient. And now you kind of have to throw all that out the window and reevaluate how you run calls and run them completely differently, because even though right now we're seeing about a quarter of our calls being COVID-19 calls, a lot of people are asymptomatic carriers. So you still have to take quite a few precautions, even if you don't think it's COVID-19.
Right. You know, you mentioned that life looks a little bit different for y'all now. I mean, we've seen the images of some of the things y'all have to wear. What are some of the things that the public can expect when we are wondering, should we call 911 in an emergency? And how are y'all kind of handling that and letting the public know?
Yeah, we have a pretty strong social media campaign that we've been working on with the city. And primarily, if you have a fever that can't be controlled with fever medications, if you have real shortness of breath, then you should call 911. If you simply have a fever that can be controlled with fever medications, if you have a headache, if you have tiredness, you should call your primary care doctor or community care and set up a test to go get tested for COVID-19.
Mm-hmm. And Selena, what are some of the ways that the public can help y'all? You know, not only with supplies, but in anything else. What else do y'all need help with?
So right now, a lot of people have asked to donate PPE, and that has been really great. Med to Market donated 5,000 N95s yesterday. I think the thing that we're shortest on right now is Tyvek suits that we're still trying to source. We also have a relief fund to help medics that have been infected either by getting COVID-19 or also who are quarantined and unable to see their family for 2 weeks. I think that the biggest thing that the public can do is as soon as they start getting symptoms of COVID-19, so as soon as they notice a cough, as soon as they have a fever, please call your primary care doctor or community care to get a test.
Okay, very good. Selena, I'm sorry, we had a little bit of interference. Real quick, do you have a website on that relief fund that you mentioned?
Yeah, so it's austinemsrf.org.
Okay, perfect. Thank you so much, Selena, and thank you so much to you and all the other medics that are out there working for us in our city. Thanks for being with us.
Thanks for having me.